I will talk about ozone in the practice because I have a studio in the north of Italy and I don't really do research, so I'm going to show you some pictures of patients I've treated with the ozone external therapy. About me, I did rehab medicine and I did my training in 4 continents, and since 2012 I'm in the clinic in the north of Italy. So what can you expect from this presentation? It's basically the effects of ozone therapy on poor healing wounds. It's the first part. And the second part is how to show the effects of the major autohemotherapy in the dark field microscopy. I will explain this procedure later on. So ozone, we all know what it is. I don't think I have to present too much about the ozone radical. And as I'm used to talk a lot in front of normal clients, this is a bit of a non-scientific comparison, because if you press, I always used to explain them, if you press together the oxygen, you get ozone, and you can just compare it. If you press together a pencil lead, you get a diamond. And what is more precious is obvious, and I think that stays in people's mind, and so they can understand why ozone therapy is so effectively. Does anybody of you practice with this external ozone bath? Yeah, so you may also have experiences, and for those who are not familiar with the procedure, we just put the limb or the place where the wound is in a plastic bag, and then we take out the air, the room air, and in the second moment we inflate ozone in a different concentration into this bag. So the first patient I brought for you here, he is a male. He was about 6-7 years old when he came, and he did alcohol abuse, and he had chronic circulation disorders already in his legs. And he was working in the forest, and because Südtirol there's a lot of forest, and especially men, they love it to do some woodwork. And he got injured with a stick, and he was 3 months with his family doctor and with the local hospital trying to close his wound that he had in the legs. And then he came to my practice, and I applied ozone gas bath and let it first in a high concentration here, and the application was for 20 minutes per session. So he came 10 times for 3 weeks, and this is how he showed up, like with this and with this. And then we had this here after the 10 sessions in the 3 weeks. I mean, you can see he's obviously not healthy. He's not like back to complete health, but the wound was closed, and it also stayed closed. Then we have the second case. This is a 42-year-old female. She is a long-term patient of mine, and she is massively obese, and she has a pre-diabetic hypertension, thyroid hyperfunction, and as a profession she is a cook. And what happened to her? She was there cooking, and some fat, some boiling fat, reached her tummy, and actually she came to see me due to another reason, and I started to speak with her why she has this belly covered. And then we also started with the ozone gas bath. So this was the initial picture. You can see there was already necrosis, and this was about 12 centimeters long, like a hand, like a palm of a hand. And then we had this after 4 treatments, and this here after 6 treatments, after 2 weeks. And then we let it just open on the dry air, and after 3 weeks the result was this, and she didn't need any more treatments. So the next case is a male patient who's at the time he was 43 years old, and in summer he worked as a mountain bike guide, and in winter he worked as a ski instructor. And between these 2 seasons he did some skiing uphill, sort of like walking up the hill, and it was quite warm, so he had his pullover pulled up, and then he slipped, and on the bare ice he got injured the lower arm. He injured his lower arm, and that was quite badly. So as he wanted to take part in a mountain bike course on the Lago di Garda, on the Garda Sea, he actually didn't dare to go because of the risk of infection. And so he visited me in the practice, and with him we did a more complex treatment. We had the ozone gas bath, also the major autohemotherapy, and at the local hospital he got some ointment for burns, and he came in 6 consecutive days. So this was the initial situation here. Like you can see, it was the whole lower arm affected. And then we had these 6 treatments in 6 consecutive days. And we can see this, everything was what was black and necrotic before just went away, and he could go to his mountain bike course. He was very happy, as you can imagine. Okay, then we have one more case. This was 76-year-old female in good condition, and she had a callus on the 2nd toe on her foot, and she tried to remove it herself, and she cut herself in the foot, and then she came 2 weeks after the cut, and we did the ozone gas bath. Actually, these pictures are not they're a bit blurred, sorry for that. So this was the initial situation. You can see the picture. And this here was after 4 treatments. And it was only last week, so I asked her to come back for a final picture for the presentation, but this was already healed, so she didn't come back. So sorry, I haven't got the final picture. But with the 4 treatments of ozone therapy, she solved her problem. And then we have this male patient, 87 years old, and he was also a diabetic, and he had the condition after chemotherapy, and he was also working in the woods and got injured, and he had a big blister there at his ankle, which they opened in the local hospital, and during 3 months they just couldn't close the wound with a different modern wound treatment, and with the honey and with sort of different natural therapies. So as his son-in-law is one of my patients, he just sent me the man and said, well, do whatever you want and whatever it costs, but close it. And this man came during 3 weeks. He did the local ozone injection around the wound and the ozone gas bath for 17 sessions. And the initial situation in this case was this here. So you see, this was quite huge, and in the diabetic, it just didn't heal. Then, after 8 treatments, we could already see that it's getting better. And after 17 treatments, within 3 to 4 weeks, it was like this. And then we just left it open, and it was completely closed in the end. So it also stayed closed. He lived another 4 years after this treatment and then died due to another reason, but as you can see, this was a very good result. Well, this was the first part of my presentation, and the second part is how to make the effect of the major autohemotherapy visible. I mean, we had a lovely and very scientific presentation before, how the superoxide dismutases and the glutathione and all this work together to reduce microinflammation. And the dark field microscopy is another option to make it actually visible to the patient. This is the aging effect. If we have too little antioxidants in the blood. And I also practiced major autohemotherapy, as we all know it, with a bottle from Ozonosan. And the dark field microscopy, does anybody know it? Like, we all know the bright field microscopy, which is used to make like samples visible that are already not alive anymore. And the samples are stained, and the light passes through the sample. This is the classical method of microscopy. And the dark field microscopy is a different method. It's already known since more than 250 years, and it's used to make living structures in the blood visible. So actually we don't need to stain the sample, and we just use a different condenser, so the light doesn't go through straight, but diagonal. And this would be a normal picture, a normal healthy blood, where we can see the red blood cells, the white blood cells, the platelets, and the plasma, which in this case is clear. So this is a pathological phenomenon where we can see the red blood cells clot together, and as you can imagine, the circulation there is not good anymore. And in the larger magnification, we have the platelets here, and normally they should be small and like little clouds, and here they stick together and they produce all these fibrin, the protein, which is a sign of microinflammation. So this is the initial situation sometimes that I find in the pictures. Here we even have a chain of bacteria, that grows in the blood, and the red blood cells have some content which shouldn't be there and which is an indication of malnutrition, of a disequilibrium of the acidity and alkaline milieu in the body. And we also see here some little structures, they don't belong to the blood. Then another unhealthy condition is the symplast. These are excrements of internal fungi that we have, like the Aspergillus niger, the black fungus. And we see the different parts here. So we try to reduce all these conditions, and the examination in the dark field is made on an empty stomach or 4 hours after having the last meal. The patient should drink a lot of water, and we take the blood from the finger or from the earlobe. So it's a little bit invasive, but you can also do it in children because the earlobe here is not very painful. And the first case I brought here was an 82-year-old lady, and she also was a diabetic and had hypertension, and she already suffered or had a stroke and had a little bit of deficiency in the left limb. So this was the initial picture in the dark field microscopy. And as you can see, the red blood cells, they clot a little bit together. Here we have the fibrin from the platelets, and we have all these little proteins. That's like a snowstorm if you see it in the video. And what we did on her were 10 major autohemotherapies. And I also work with chelation, like to reduce the microinflammation in the intima, in the endothelium. And this was after these 10 sessions, after 10 weeks. And you can see a very visible difference, like the red blood cells, they are unclotted. They haven't got any content. The plasma is clear. The platelets are small as they should be, and the fibrin of the microinflammation is gone. So the second lady, she presented herself with the intestinal candida, and she came because she was always craving for sweets, and actually her diet contained only sweets at the time. Then with her I did rectal inflation, the 10 micro, about 450 ml per session, and she had a diet for 4 weeks where she wasn't allowed to eat short chain sugars, also no fruits like banana or grapes, and no yeast. And this was the picture in the dark field microscopy at the beginning, when she first presented herself to the studio. You can see the fungi with the hyphen here, which was actually really scaring herself, and she printed out the result and put it on the fridge. So every time she wanted to eat some sweet, she looked at this picture, and then she refrained from eating sweets. And then after the therapy, we can see the blood very healthy, like I presented in the initial introduction. We have the red blood cells unclotted, the platelets small and like little clouds, and this one is a lymphocyte. And here we see the enlarged picture, and all the fungi is gone, all the candida is gone. And she felt a lot better. She didn't have the maldigestion anymore, and craving for sweet completely vanished. So this was the, yeah, some question? I did the tongue. You can see it on the tongue. This is this landscape tongue where she had this white cover and the red dots in it. And then is also the anamnesis. If the people tell you about bloating and they fart loud and farts are not very smelly, other than the farts are very silent but very smelly, then there is another problem, and the craving for sweet. So this were from the three major points out of the questioning why I thought about Candida, and then I saw it in the microscope. If not, I could have done a stool sample and send it to the lab, and then it would have shown the Candida too.
Vaginal insufflation, ozone, or rectal insufflation?
Well,
the infection are in vaginal. The Candida.
If the Candida, that's a very good question. Thank you. If the Candida is in the intestinal, I do intestinal rectal insufflation, because also the major autohemotherapy would be, I think, too strong. So the Candida would die off too quickly and give a lot of symptoms to the patient. So the rectal insufflation is more subtle and very effective. And vaginal, I do it if they have vaginal Candida.
Yes, we in Indonesia seems often patients because in the village, female with that kind of problem already go to the dermatologist, but yeah, sometimes with diabetes, the diagnosis is Candida in vaginal, which is the best, perhaps directly into, because I've already also read there's a publication in it, ozone in vaginal insufflation. Not many publication, of course. The many is the rectal insufflation, which is perhaps from your perspective, which is the best if the problem is in the women vagina from yeast.
Actually, I use the vaginal insufflation if it's the vaginal Candida, because it's directly there.
The dose, because vagina is we don't want to hurt the patient. The dose, perhaps you can share.
The dose, I take the 10 microgram per milliliter.
How much milliliter inside?
I do about 50.
50.
Not so much, yeah.
Oh, I see.
It's not.
The other question: what about the if the gangrene in the foot are from deep vein thrombosis? Do you have an experience?
This is another very good question. If it's the gangrene is from thrombosis, I use the ozone gas bath and the major autohemotherapy and the chelation. So the chelation is the EDTA chelation that takes out like the calcium, and that also reduces the microinflammation of the endothelium, and that also stimulates the angioneogenesis.
The dose, perhaps, Dr. Karin, can you recommend to the vein thrombosis, the dose of the ozone bagging to the gangrene from DVT?
Oh yes,
How
yes.
much the dose?
Well, if it's infected, I take a very high dose, like 60 microgram. And sometimes I also had the case that one toe was already completely black, so it died off. So this guy had to go to the surgeon, obviously. But then later on, the healing,
Reduce.
he did this ozone gas bath.
Yes.
And when there is no bacterial infection or infection of any kind anymore, then I reduce the dose to about 30 microgram. But if I can see that it's already infected, then I use sort of the highest dose I can get out of the machine. Yeah.
Okay. Thank you, Dr. Karin.
EDTA, the dosage of chelation.
The EDTA chelation. Well, I follow a certain protocol because I'm a member of different societies, so I have to follow their protocols. And there is a blood check, and before you start chelation, and then you get the kidney parameters. And if the creatinine is 1 or below, you can give up to 3 grams. And if it's higher, you have to reduce the dose. Like if it's 2, I give maximum 0.3 gram, 0.5 gram, slowly.
Once a week?
Once a week. But people with a good kidney function, they can also come twice a week. Yes.
Thank you.
For those doses, how do you select your dose for different procedures, and for how long do you have to give? Is there any guideline for that?
For the ozone or the?
For ozone.
Well, the
strength that you choose, like 50 to 60 mic. So how do you come up with
this dose?
Yeah.
Well, I think I've heard this from the Dr. Fiban, and in the book, and also by a little bit by experience. So, are you asking about the dose for the infected wounds, or?
Yes, I just want to know, if we come across different kind of cases, how do we go about some particular dose? Is there a criteria for that? Is there a guideline somewhere? Or is it just the experience?
This is more experience. I think it's more
Okay.
experience, like.
All right, thank you.
Any more questions? Thank you very much.
Thank you very much.